our favorite show, Dr. Elizabeth's Advice. Once again, this afternoon, we send greetings to our viewers and bring you more recommendations to have better habits and enjoy better health. Remember that preventing diseases helps you to enjoy a healthy life. Today we will talk about two diseases that are related and that, in addition, are very common among people. The topic to be discussed today is gastritis and colitis. Well, start by defining gastritis. Gastritis is a general term for the group of disease with one point in common: inflammations of the stomach lining. The inflammation of gastritis is usually caused by some bacterial infections that cause most stomach ulcers. Frequent use of certain pain recipes and drinking too much alcohol can also contribute to gastritis. Gastritis can happen suddenly or it can happen slowly over time. In some cases, gastritis can lead to ulcers and increased risk of stomach cancer. But for most people, gastritis is not serious and improves quickly with treatment. The signs and symptoms of gastritis are pain or burning in the upper abdomen. They can be better or worse when you eat. Vomiting, feeling of folds in the upper abdomen after eating. On the other hand, colitis is inflammation of the large intestine that causes, in general terms, abdominal pain and distensions that is something constant and something intermittent. It is known as colitis. These conditions can be caused by different factors. Therefore, its treatment and diagnosis vary in each person. Its symptoms can be diarrhea, abdominal pain and cramps, rectal pain, rectal bleeding, see a small amount of blood in your stomach, uncontrolled urge to the bathroom, inability to despite having the need to do so, weight loss, and fatigue. Both pathologies are caused mainly by eating habits. For the reason later, we will give some advice that you must have in your daily life to reduce the risk of suffering from the diseases or in case of already suffering from it. Reduce its symptoms and have a speedy recovery. Next, we will read a letter that Fernanda sent you and we will answer your questions.
Motion Elements.
Dear Dr. Elizabeth, I am writing to from the community of New Wixtan, Chiapas to ask for your help. Since I was child, my mother has always supervised in my foods. However, I never paid attention to my mother and ate space and acid things. I am currently 25 years old and suffer from gastritis and colitis. I have received many treatments, but the problem persists. It has made my situation difficult that I cannot even consume things with fat because they cause reflux and heartburn. It is very ugly to suffer from the diseases because when they invite me to a party, I cannot always consume what they give to eat. On the other hand, many times I want to eat certain things such as tacos, pizza, or hamburgers, but I cannot have the space to them, and this cannot allow him to enjoy certain foods. Therefore, I ask to you give me some advice that I can follow to improve my situations and later continue with my normal life. Believe me, it is very difficult to go through this and the symptoms are intolerable. I am afraid that my illness will get worse, and that is why I am seeking professional help. My dear Fernanda, thank you very much for sending us your letter. As we can see, dear viewers, these new pathologies have a lot to do with eating habits. As our dear Fernanda mentions, since she was little, she consumes foods with a lot of spices and acids. Therefore, the recommendations to prevent gastritis are the following. Number 1, avoid eating very fatty and irritating foods. Avoid taking aspirin and anti-inflammatories, as they tend to be very aggressive with the digestive system. Number 3, eat breakfast daily so that gastritis just do not damage to esophagus. Chew well and slowly. Have a light dinner. On the other hand, the tips that I give to prevent colitis are: number 1, follow a complete and balanced diet. Eat smaller portions and more often. Eliminate tobacco from the life. Don't give up physical exercise. Manage stress. Avoid certain medications. Don't leave the treatment halfway. It is also advised to carry out some studies in case of presenting very severe symptoms and to go to a family doctor to take an adequate treatment and to be able to combat both diseases. Thank you very much for joining us on your favorite show, Dr. Elizabeth's Advice. See you next.